What is Spanish flu? The Spanish flu was a very serious sickness caused by a type of flu virus. It started from birds and quickly spread all over the world. Because it was new, not many people had built up immunity to it. From 1918 to 1919, the Spanish flu infected about 500 million people around the world. That was roughly one-third of everyone alive at the time. Sadly, it caused the deaths of around 50 million people, with about 675,000 of those deaths happening in the United States. Just like the flu we deal with today, the Spanish flu hit babies under 5 and older adults over 65 the hardest. But what made it even scarier was that it also took the lives of many healthy young adults, aged 20 to 40 years old. How Spanish flu does affects your body. The Spanish flu affected the body like a bad flu. It mainly attacked the lungs, causing symptoms like fever, coughing, and trouble breathing. Sometimes it led to a severe lung infection called pneumonia, making breathing even harder and causing chest pain. In some cases, the body's immune system reacted too strongly, causing inflammation and making things worse, especially for healthy young adults. Overall, the Spanish flu made people very sick by messing up their breathing and causing serious lung problems. What were the symptoms of the Spanish flu? The Spanish flu caused a range of symptoms which could vary in severity from person to person. Common symptoms included fever. High fever was one of the hallmark symptoms of the Spanish flu. It could be accompanied by chills and sweating. Cough. A persistent, dry cough was a common symptom of the Spanish flu. It could be severe and contribute to respiratory distress. Sore throat. Many people with the Spanish flu experienced a sore throat, which could be painful and contribute to discomfort. Difficulty breathing. Respiratory symptoms were prominent with the Spanish flu, and many individuals experienced difficulty breathing or shortness of breath. Fatigue and weakness. The flu often caused extreme fatigue and weakness, making it difficult for individuals to carry out daily activities. Muscle aches and body pains. Body aches and muscle pains were common symptoms of the Spanish flu, contributing to overall discomfort. Headache. Many individuals with the Spanish flu experienced headaches, which could range from mild to severe. Nausea and vomiting. Some people with the Spanish flu experience gastrointestinal symptoms, such as nausea and vomiting. It's important to note that symptoms could vary in severity, and not everyone experienced all of these symptoms. Additionally, the Spanish flu was known for its ability to cause severe complications such as pneumonia, which could further exacerbate symptoms and lead to respiratory failure and death. How was Spanish flu treated? During the Spanish flu pandemic, medical treatments were limited compared to what we have today. At that time, there were no antiviral drugs or vaccines available to specifically target the influenza virus. Instead, healthcare providers focused on supportive care to alleviate symptoms and help patients recover. Here are some common approaches to treating Spanish flu during that time. Bed rest. Patients were advised to get plenty of rest to allow their bodies to fight off the infection. Bed rest helped conserve energy and prevent complications. Hydration. Maintaining adequate hydration was crucial, especially for patients experiencing fever, sweating, and respiratory symptoms. Drinking plenty of fluids helped prevent dehydration and support overall health. Fever reduction. Fever-reducing medications such as aspirin were commonly used to alleviate fever and discomfort. However, it's important to note that aspirin dosages during this time were often higher than what is recommended today and could lead to adverse effects. Symptomatic relief medications such as cough syrups and throat lozenges were used to alleviate coughing and soothe sore throats. Steam inhalation and warm compresses may have also been recommended to relieve congestion and ease breathing. Isolation and quarantine. Infected individuals were often isolated to prevent the spread of the virus to others. Quarantine measures were implemented to limit contact between infected and uninfected individuals. Public health measures. Public health interventions, such as school closures, cancellation of public gatherings, and promotion of personal hygiene practices like hand washing, were implemented to reduce the spread of the virus within communities. It's important to note that while these measures were implemented during the Spanish flu pandemic, they were not always effective in controlling the spread of the virus or preventing severe illness and death. Today, with advancements in medical science and technology, we have antiviral medications and vaccines that can help prevent and treat influenza infections more effectively. How was the Spanish flu prevented? Back during the Spanish flu, there weren't any big rules all over the country to stop it. But some towns did things that we still do now to keep sickness away. Staying away from big groups of people, like by closing schools and gyms, washing hands a lot and really well, wearing things like masks and gloves to protect yourself, not touching stuff that lots of people touch like library books. Not spitting in public.